and they have older people. Westchester, there's a 12-year-old female, 17-year-old male, 45-year-old male, 55-year-old male, 14-year-old male, 7-year-old male, 51-year-old male, 82-year-old male. Nassau, 63-year-old female, 41-year-old female, 36-year-old female. This is actually good news in some ways because it says the process is working. You get a case and you follow that case and you test that case because you want to find the people who were infected. You want to isolate those people so there's not continued spreading. That's what this is all about. It is not a perfect process, but the more people who you can tell you are positive and stop them from infecting other people, the better. So we'll continuing to do this. We'll continue to inform people who are positive to quarantine themselves so they don't infect other people, and that's how we will work to contain the virus. That nice noise suggests, we don't know what it suggests. So that's the update. One other announcement, one of the issues, one of the consequences to this, an economic consequence, is people are worried about traveling, not just to the countries on the CDC watch list, but just traveling in general, because they're afraid if they make plans, they may be canceled. If they buy an airline ticket, it may be canceled, something may come up. That is constricting travel, constricting business travel. It's not good for New York, it's not good for any state, because it can actually slow the economy. It's one thing to make a purposeful decision to stop a gathering. It's another thing to have people just canceling trips because they're afraid something may come up and then they'll be unable to redeem the airline ticket, etc. Department of Financial Services, Superintendent Linda Lacewell is going to announce a program where she is going to authorize travel insurance which you can purchase, which is unconditional. They have travel insurance programs, but they normally exempt epidemics, diseases, etc. She is going to authorize an unconditional travel insurance program. So if you buy this insurance, you cancel for any reason, including anything related to the coronavirus, you can get the full amount of your airline ticket back. And we think that will provide comfort and encourage people. Questions on the trip?
On the new cases, how many are related to the first case, the Westchester lawyer?
We believe, we have more investigation to do, but we believe the majority.
Okay, so like ballpark, how many?
I don't know, we're still doing the investigation, but we're going down that road, right, for many of these tests.
What's the relationship like? Like what were the interactions? Do you know any more details about that?
Well, he attended functions at the temple. He attended a bar mitzvah. There were a large number of people in this gathering. He contacted a large number of people. And we are very exhaustive in the testing follow-up. Now, again, remember, and this is why when we say nobody knows the denominator, there may have always been a lot of people walking around with coronavirus already. There may be a lot of people walking around with coronavirus today who we don't know and who will never know. You may very well have the coronavirus, you're walking around, and it then resolves, and you never even knew you had it. What we're doing is we're focusing on, once you have one contact, following that tree, right, to stop people from infecting other people. And that's all good that it helps the spread. But again, people can have it already. People could have had it and it could have been resolved by now. People can get it and not know they had it and it can resolve.
In Nassau County cases, are these all related to the first person?
Same. We have to do more investigation, but we believe they are.
The Long Island cases are connected to the New Rochelle.
No, Long Island cases, were Long Island connected to New Rochelle? No.
The city is concerned about its backlog, about the amount of kits it has to do these tests. They're calling for the CDC. My understanding, Doc, is we've got about 3,000 kits for the state. So do we have enough? And is there a talk that, obviously there's the friction of distance, but for Wadsworth to do tests from the city if that needs to happen?
Yeah, we are now.
You are doing tests for New York City?
Yes.
How many?
Well, we are managing the testing for the entire state from everywhere, and then we're more and more aggressively subcontracting with private labs to do it also. But we do testing from New York City. They have a laboratory that's just coming online now, so they can test, or we can test for New York City.
So obviously, to get the sample, it's just a swab and probably a sterile container. That's easy. Talk to me about the actual test. Is there some sort of special agar? Is there some sort of special indicating paper? What's the limiting supply?
So, well, I'll explain to you the test. And we have thousands of test kits to do. It's very much like if you had a Q-tip and you put the Q-tip in the back of your nose or back into your throat, and then it gets put into a special solution that's transported to the lab. And from there, the lab technician will break it down to get out the RNA, to break down the cells. Then it's put in another machine that takes out the RNA, which is the nucleic acids. After that, it goes into another machine that adds the ingredients that will then replicate the RNA so that you actually have millions and millions of copies of it. Then that machine will identify it on a graph on a computer and show that there's coronavirus.
But there are two hurdles, Jimmy. The first is the sampling and sampling equipment. That's what the city's talking about with the sampling equipment. The CDC was supposed to provide sampling equipment. That's what many of these governments are saying. CDC hasn't provided them enough sampling kits. We have, anticipating this, we went and we purchased additional sampling kits. So if any government in New York State needs sampling kits, we can help provide them. But the CDC was supposed to be providing sampling kits. They've been slow in providing the sampling kits. That's what New York City is talking about. Once you have the sampling kit, which is relatively straightforward, this Q-tip and the solution, and then it gets sent to the testing is complicated and is time-consuming, and you need chemical agents, and it goes through 3 machines, and it's a several-hour process, and you need a sophisticated laboratory to do that. And that is luckily in New York, we have Wadsworth, we have Northwell, we have Mount Sinai, we have many labs that can do it. Our frustration on the state side was getting the CDC to allow us to do it rather than sending it to the CDC down to Atlanta, waiting for it to come back, getting the state to use their lab. Our second frustration was getting the CDC to allow us to contract with the outside labs.
Clearly, I understand that. There's clearly a difference of opinion as to the adequacy of the current number of tests. Obviously, there's 9 million people who live in New York City. They've got 1,000 kits. We've got 19 million New Yorkers. We've got 3,000 kits. So there are people, and I'm hearing from them on social media, we're talking to them who say, I want to get tested, I can't get tested, there's not enough tests. Your response to them?
No,
and also,
they're mixing apples and oranges. That's what I said. When they say there's not enough tests, there are sampling kits which do the sampling, which are relatively straightforward. New York City might have a shortage of sampling kits. New York City would be right to say CDC was supposed to send us sampling kits. We have sampling kits. Then the sampling kit goes to the testing. There is a capacity issue on the testing. So the correct statement would be, I want to be tested, but there's not enough testing capacity, which is what we were talking about this morning. The CDC puts out guidance. Anyone who wants a test, come and get a test. Tell your doctor you want a test. Vice President Pence says, oh, we can't do the tests. That's the disconnect.
congressional delegation have taken issue with some of the comments that you've made about the federal funding bill that they passed. They argued that they really pushed for a funding formula that benefited large states like New York, and they've noted that that $35 million is out of a $950 million that was put aside for states. Just wanted to get your response to that.
I don't think it's enough, and that's how I feel. I know when someone passes a piece of legislation, they don't like anyone to criticize the legislation, but the reality of the situation is it's not enough funding for the state of New York, period. They knew that I did a supplemental appropriation of 40. They knew the 35 was not 40. They knew that.
Do you have a target for how much money you would like to
I don't know, but it's going to be multiples of the 40. And by the way, this state routinely gets the short end of the stick from the federal government. Routinely. FEMA doesn't allow reimbursement for the Mohawk flood. DHS turns off our Trusted Traveler program as a matter of extortion. The SALT tax, no Gateway Hudson tunnels, no Second Avenue subway approval, no congestion pricing approval. So, yeah, you're the federal representatives. I understand that. I also understand that New York is being mistreated by the federal government, and we're constantly getting the short end of the stick. I understand that we're not on the President Trump's hit parade, but the delegation's job is to advocate and deliver for New York. Advocate and deliver for New York.
So you don't think Schumer and Lowy have done that?
I'm sorry?
I said, so you don't think Schumer and Lowy have done that in this case?
Schumer and who?
Neil Lowy?
I'm sure they've advocated, but look, you know how I get measured here? Nobody says, oh, you get an A+ for effort. You really worked on that bill. You really tried. You tried to get the budget done on time. A+ for effort. They say you didn't get the budget done on time. It's absolute. It's binary. You got it done or you didn't get it done. And this legislation does not have enough money for the city, for the state of New York. And it's an $8 billion supplemental. How does it get to $950 million? We got you a good piece of the $950 million. How did it get to $950 million from $8 billion? When the vice president is on the phone saying to me, don't worry, we're going to make sure the states get the funding. And forget that. We are managing the situation. You can't ask us to take this on, handcuff us. State can't test, state can't use private labs, and then say, we're not giving you funding.
Do you have an update on the 2,700 individuals who were quarantined in New York City from yesterday?
What update would I have?
Are there more people that are under quarantine?
From what I gave you this morning?
Yeah.
No.
So it's still 2,700?
Same as this morning.
Just get back to Nancy for a second. When you said that these cases.
You're very concerned on Long Island. Is there a particular reason?
My job.
Yeah, I know. Oh, besides, yeah, that's a good point.
When you say they're related.
Good answer, good answer.
If I could ask, when you say that they're related to that first person, is it a family-friend relationship, or is it related to people from his workplace?
We don't know. We know the results. We haven't done the investigation. I'm not keeping it from you. We just don't know.
Just on the New Rochelle piece here. So I think they're quarantined through Sunday, I believe, according to the county.
Some are. Some have longer
Some
quarantines.
have longer quarantines. So as this grows in that area, do you revisit that and say, you know what, maybe we got to keep certain people you were going to
When
be
you
released
find,
Sunday,
yes.
maybe you'll go Tuesday.
When you find out that someone was exposed to someone else who was positive, the clock can start ticking again.
And then the New Rochelle, the first case. Any more indication of how he contracted it? I mean, you had the first one was a worker in Iran, but in this case, there was no indication that he traveled abroad.
You know, I think it goes back to what the governor said before, that there is communal spread, and once you start testing, you're going to find individuals. So perhaps, but he ended up sick enough to end up in the hospital, right? And so all of a sudden the test gets done, and then you find out he has this, but he could have been one of the individuals who would have been walking around and got better.
What do you do with a group of a community that might be stuck in their homes for 14 days, 7 days, however long it is. I mean, what can you do as a government to assure that they're getting supplies, getting the things they need? I mean, a lot of them go to temple every day, they can't go, you know, all the things that disrupt their lives.
Exactly what the local, that's the charge, State Department of Health works on that, but also it's the direct charge to the local departments of health. Would you like to give some specifics on the travel insurance program?
Thank you, Governor.
My
So, the Department of Financial Services is taking the governor's direction to maximize how we can help people and to get rid of obsolete regulations and opinions, which is what happened in the state of New York. There is a form of travel insurance benefit called Cancel for Any Reason. People use this to plan their lives. They can't specify what the reason is going to be, but if they want to travel in November, they don't know what happens between now and then. They want to be able to cancel. Most travel insurance policies outside of that don't allow you to cancel for any reason and don't allow you to cancel based on a public health epidemic. So we're scrapping that obsolete reg and making this form of insurance-related ancillary benefit available. Travel agents will be able to offer it. Travel insurers will be able to offer it ancillary to other travel insurance that they provide. And again, this is designed to help individuals and businesses move forward and plan their lives with some kind of reassurance that if they need to cancel, they'll be able to get a segment of their money back.
That's all prospective.
Correct.
So people who maybe already booked
Right.
their plane
Right.
tickets, their
Correct.
Governor, is there any update on how some of the city campuses are being used for people who need to self-isolate or be quarantined?
I don't have the facilities yet for you, Nick, but the way the general program will work is they can home quarantine. If they can't home quarantine or they don't want to home quarantine, you know, this is a student who's coming back who says, hi, Mom, hi, Dad, hello, brother, hello, sister. By the way, I'm going to quarantine here because I may have the coronavirus. You may get a father or mother, brother or sister who might say, no, you're going to quarantine somewhere else. I love you, but call me in 14 days. So the home quarantine or dormitories, if they don't have home quarantine available, is an option. And we will identify, but they're going to be SUNY dorms on campuses. I don't think the exact SUNY dorm is that important, but we will have the locations. Also, just to reiterate a point and put an exclamation point in it that I made earlier, I believe they are selling stolen medical equipment on eBay and like vending services. I was the former Attorney General. I did cases off eBay. It is the easiest way to find someone. And I believe that is going on now. We know there have been thefts of medical equipment. We spoke to a couple of hospital administrators who told us wild stories about the audacity of people stealing masks. Sounded like a skit out of a bank robbery. And I believe they're selling them on eBay, and we're investigating that. If you are doing that, you will be caught because the devices can be tracked back. Everything gets tracked back. So that is fair warning. Stop stealing. Stop exploiting the scam. There are special laws that have been written. We went through this during Hurricane Sandy with gas price gouging. So beware.
Andy Byford did an interview earlier today with CBS, and he said that working in his former role was intolerable and that working for you specifically was not his favorite job. He said, I needed to be left to run the system. I felt myself being undermined, if I'm honest. And he said that he felt specifically that he was being undermined by you. Do you have a response to that?
I didn't work with Andy Byford. I worked with Pat Foy, I worked with Ronnie Hakem, I worked with his higher-ups, and he didn't run the system. The board runs the system. The president runs the system, Pat Foy. The operating director runs the system, Ronnie Hakem at that time. They run the system. That's who runs the system. I worked with Pat Foy. I worked with Ronnie Hakam. Also, you have to remember, the major changes that were happening at the MTA are a function of the Subway Action Plan, which started before Andy Byford, and went on during Byford, and continues to go on. And the Subway Action Plan, I don't even know that you were here when it started, but I put the Subway Action Plan into operation. I had to get legislation passed. I had to work with the city. I spent months in the subway, in the drains, in the tunnels, in the electric rooms, coming up with what needed to be fixed with the Subway Action Plan. And that started before him. It continued during him. It continues today. I'm still involved in the Subway Action Plan, which is where the main changes are being made. But I work with Foy and the board, Ronnie Hakam. There's now a transformation plan that also happened that brought in 2 new senior people who are managing the overall situation. And then you have 3 heads, Long Island Railroad head, Metro North head, Transit head, but you have, you know, supervisors and bosses above them, and I deal with the board and the head of the agency.
How do you feel about him saying that he was undermined by you? Like he said.
No, if anything, he was overmined because I dealt with his bosses. Thank you, guys. I deal with the head of an agency. If you call Office of General Services and you talk to a deputy and say, how is it to work with Governor Cuomo? The deputy would say, I don't know. I have never worked with him because I work with the commissioner. And then the commissioner turns around and works. That's chain of command, that's protocol.
Did you like him?
It was never, so Pat Foy, board, Pat Foy, Ronnie Hakam, and then the 3 division heads. I work with the board and the head of an agency. That is the normal operating protocol on every agency I deal with. Thanks, guys.